Good afternoon, everyone, and welcome to our annual general meeting. Thank you very much for attending. I'm Richard Fraser, Chairman of St Helens and Knowsley Teaching Hospitals NHS Trust, and this is the Trust's 31st annual general meeting. And this is a virtual meeting for safety reasons due to the ongoing uncertainty surrounding the COVID pandemic. Last year's AGM was broadcast on the 17th of September and is still available for you to watch online. And because of that, there are no formal minutes that need to be approved. Now that official bit is out of the way, again, I would like to welcome you all and thank you for joining us in these extraordinary times. I'm joined today by our Chief Executive, Ann Marr, members of our Trust Board, and our executive team. So before I pass you over to Ann, a little bit of housekeeping. As with all online meetings, there may be a little interference or slight delays sometimes. So bear with us, and if we experience any unexpected issues, we will come back online as soon as possible. Microphones are set to mute, but if you have any questions following the presentation, there will be an email address you can contact us, and we will try to answer your questions as soon as possible. This meeting is being recorded and will be available online following the close of today's proceedings. So the agenda for today's meeting is as follows. There will be a review of 21-22 and with Ann Marr presenting, Ann Marr OBE, our Chief Executive. We will then have our COVID story, our achievements during the year ahead, and then our ambitions and objectives. In a moment, Ann Marr will review the Trust's performance during the year and talk you through our COVID story, recognising our achievements over the last 12 months and look ahead to the future. So that's all for me now, and I will pass you over to Ann. Over to you, Ann.
Thank you very much, Richard, and good afternoon to everyone who's joined us today. So I'm pleased to be able to officially review the year 2021 to St Helens and Knowsley Teaching Hospitals NHS Trust. This review will cover a review of activity and performance against the various standards we're required to achieve, and also set out our key priorities for the forthcoming year. So let's begin with activity, quality and performance. So this is a schedule showing the Trust's activity for 2019-20 and 2020-21, but also the year that we're reviewing, which is 21-22. And the reason for showing 3 years is that we really need to do comparisons between 21-2 and 19-20, because the intervening year was the year of the pandemic, and therefore many of the metrics were distorted by the fact that we had obviously all of the COVID patients to deal with. So just going through the list and pulling out where there've been, quite significant changes. So that very first line, so again, bear in mind that I'm now comparing 2021 to 22 with 1920. So between those 2 years, so a normal year, if you like, 1920, GP referrals have gone up by 12%. Don't think we've ever had as big an increase in GP referrals in 1 year in the past. So quite significant. Now, I guess some of this could be to do with the fact that during the intervening year, there weren't so many GP referrals. You can see that big drop in the year. So it's a bit of a catch up of referrals. So, not only have we got waiting lists brought forward, we've got, more people being added to the waiting list as we've had so many more GP referrals. So if we analyse that further, there's nothing remarkable in terms of where is that from. It's largely from our natural catchment population. largest growth of 30% from Knowsley, and the main specialties that affects have been the biggest growth is in gastroenterology and gynecology in terms of specialty growth. So the next remarkable figure is the cancer 2-week wait referral. So this is where patients are referred by GPs under the urgent cancer rules, and our requirement is to see them within 2 weeks. Now, again, this will partly be attributable, this increase will partly be attributable to people, not presenting during 2021, although you can see the referrals are actually only down by 4% in that year. But obviously there were people who didn't present because of the pandemic, and now, there's this kind of backlog of urgent referrals that are being received through the 2-week rule mechanism. Again, haven't looked at, is that coming from our own natural catchment or beyond? And, it's very clear from the analysis of those figures that there is an element of a change in referral patterns from some shared populations where, there is, an option of where the patients are referred to, do seem to be picking up cancer referrals from slightly outside of our natural catchment area, who are all very welcome, but just add to the numbers. In terms of the kind of puzzling thing between the hospital feels extremely busy, and yet what we see there is that the emergency department attendances, are up by 3.5%, but the actual admissions are down by 1.8%. What's happening there when it does feel like the hospital is full all the time? And I guess the explanation for that is obviously more people are attending A&E, but what we've tried to do is introduce more services so that people can be seen on an ambulatory basis without being admitted. And that's why we're not seeing that kind of, parallel line between attendance and admissions. However, the hospital is extremely full, pretty much all of the time at the moment. And the reason for that is that those patients we are admitting are therefore of much higher acuity. And that's a challenge in its own right, but also we're also having some issues with the ability to discharge patients because of capacity in social care. So what we've got is, patients coming in and staying much longer, both because of their illnesses, but also because of the problems with discharges. And that is partly affecting our ability to complete our elective episodes, as all of our beds are kind of a lot of the time occupied by non-elective patients. But also the infection control requirements we've had to put in place because of COVID. Some of those were very much still in place in the year 21-22. So that kind of paints the picture of how the activity has been affected by the pandemic during the course of 21-22, although quite clearly from the table you can see the main impact was in that intervening year of 2021. Moving on to quality indicators. So I've pulled out the, if you like, the key quality metrics. First line is HSMR. The average for the country for HMR is always 100. That's why it's 100. And so anything below 100 is a good place to be. And as you can see, we are below 100. The next indicator I've pulled out is the percentage of stroke patients cared for in a stroke ward. So this is about ensuring that stroke patients can receive the appropriate care for most of their stay, for almost the entire stay. The actual measure being 80% of patients should spend 90% of their time on a stroke ward. So 80% is the important percentage there. So as you can see, despite all of the pressures on beds in 21-22 and the whole issues with COVID in 2021, we were able to maintain stroke performance and make sure stroke patients did receive the appropriate care in a timely way, as we had been previously achieving as well. Next line is about never events. So in 21-2 we had one never event, which was really a near miss. The patient didn't come to any harm, but we will always in these situations learn from a never event, and obviously did an investigation and implemented some new actions on the back of the event that occurred. MRSA, obviously we'd always like the MRSA figure to be 0, and that's why we've put the colours in red, even though there was only 2 MRSA cases in 21-2, and one of which, after an intensive investigation, was deemed to be entirely unavoidable, and the other case was a very unusual case as well. So they weren't cases that we'd expect to see repeated, because both of them were quite exceptional circumstances. As I say, one so exceptional that it was regarded as entirely unavoidable. But if there were lessons to be learned, then we've tried to take those on board as well. C. difficile, 32 cases, but the trust target for C. difficile is 54 cases. So whilst again we always want that figure to be as low as it can be, it is good performance against all the trusts, and indeed against the target we were set. Some of the things that we try our hardest to keep to the absolute lowest figures we can are pressure ulcers and falls causing harm. So they're always, generally featured somewhere in our priorities as an organisation. So the change in the figure for pressure ulcers, whilst it looks like it's come down an awful lot, and has been a bit of a part of that change is to do with a change in the counting methodology that we're required to follow. But even with that much reduced figure, we still like that figure to be lower. So lots of work going on, and we'll continue to go on to try and keep that figure as low as it can possibly be. And then falls causing severe harm. You can see in 2021 we had that much higher figure, and when we analysed the the story behind every one of the falls, which we do, we did think a lot of that was down to donning and doffing procedures of PPE during the pandemic, of staff not being able to get to patients fast enough to stop them finding themselves, in a compromised position, getting out of bed and walking across the room, and it taken us more time than it had done to get into there to intervene and support them. So we did manage to turn the tide a bit on that and got the figure down a bit. But again, that is the one of the things that we'll be putting a huge amount of attention into this year, to make sure we get that figure to be as low as it can possibly be. So I'll move on now to performance targets. So complicated table. So we've got what the target is, how we performed in 1920, and how we performed in 21-2, but compared that to the England performance, because obviously all the targets have gone a bit awry since as a consequence of the pandemic. So the 4-hour target for A&E, as you will all know, the target's 95%. Trust's figure for the year in question is 77.1, but kind of in line with where the national average is. 18 weeks, so target 92, so we were there or thereabouts in 1920, and that really was only because of just the last couple of weeks. If you remember, the pandemic started to evolve and erupt in the sort of last few weeks of March 2020, and prior to that point we have been achieving the target. So we just kind of the performance reduced just that little bit to take it below the 92%. Now, obviously, with having to suspend much of our elective programme during the pandemic, that waiting list has built up. So for the 21-2 performance was at 68.2%, so much lower than we've previously performed at, but still, significantly higher than the national average for other trusts. 52 weeks, the target was always to have none, and the trust, historically has had no 52-week waiters. But again, the suspension of the elective programme meant that we built up a backlog of just over almost 1,500 patients as a result of not actually undertaking the surgery. So work in progress to restore that target back to where it was. So lots of restoration and recovery work going on to address that. In terms of the cancer targets, I mentioned before about the huge increase in the number of 2-week cancer referrals. And really, that's the story behind why our performance has gone down from, you know, a quite respectable 91%, again, partly impacted just at the very tail end of 1920 by the COVID pandemic, but now down at just under 85%. But again, better than the national average. It's just a capacity issue. What I would say is that, you know, that's about patients being given really effectively an outpatient consultation. The other two targets are about when patients actually got treated. So, you know, in a way, we can almost accept failing the 2-week target as long as we get the treatment going fast once we've diagnosed the patient. And you can see that, you know, despite everything, we actually were able to achieve both the 31-day and 62-day cancer targets in spite of that, which is the time to treatment, which is probably the most important thing. And again, you know, performance absolutely outstripping the national average, because clearly, you know, we think it's you know, the cancer targets are right up there in terms of the thing we put our attention on, because it's so important that cancer patients are treated in a timely way. Just moving on to diagnostics. So the target here is that 99% of patients should wait less than 6 weeks for a diagnostic test. And, you know, again, prior to the pandemic, we were generally always achieving that. But again, the thing that's hampered this is that there's been a lot more infection control processes that we've had to go through in order to ensure patients are kept safe as they go through diagnostics. So, you know, cleaning the machinery and changing air and all sorts of things have been required. So that's what's caused the reduction in that performance. But again, a little bit above the national average, and hopefully we'll be able to remedy that situation as we go forward. And just the last one is the place the patient-led assessment of the care environment. One of the things that we normally do rather well and come top of the national league table on, but obviously postponed due to having more important things, I guess, to worry about instead of doing inspections. And obviously we can't have people roaming around because they are done by patients. Okay. So moving on to finance. Prior to the pandemic, the Trust delivered just short of a £4 million surplus. In the pandemic year itself, the plan had been to break even, but then the COVID pandemic, you know, broke out late March 2020, so that whole financial year. And during that year, the whole funding system changed, and, you know, basically the thing was that pretty much what you spent on COVID was paid for, was just covered. Towards the end of the year, we had a plan. We'd already had a plan, but we continued with the plan to open additional beds on the site in the form of the new building at Bevan Court, and so we continued that, and that's what created the deficit, because it was nothing. It wasn't pandemic spend, if you like. We were going to do that anyway. So that resulted. We decided it was the right thing to do to carry on with the Bevan Court beds. So we did, and that's what caused that relatively small and forgivable deficit. So 21-2, as a result of having strong elective recovery, because you know, some of our income was determined by how many extra cases that we did in terms of recovering the waiting list. And obviously we also had a cost improvement programme, so that was implemented successfully as well. So on the back of that, we were able to then get back into an approximate break-even situation with a small surplus of £700,000. I just wanted to move now on to our COVID story. So this graph depicts the whole story from the 1st of April 2020 to the 1st of August 2022. And just to orientate you, the blue colouring is 2021, the orange 21-22, and I'm going to call that colour maroon. The maroon colour is 22-3. So you can see we had the peak in April as the pandemic first hit us. Another peak almost as big in November, but the really big peak occurred in late January, early February 2021. So that was our third and highest peak. And at that point, that was the point we had more COVID patients. So this is the spells, and our beds had more COVID patients than any other point during the course of the pandemic. And the red line you can see on there is when the vaccine became available. So you see that going from the very sharp peak to a very rapid decline as the vaccine program was rolled out. And we did still get patients. You can see from the graph that we did still get patients, but the patients you can see in the later months were very much less acutely ill than the patients we saw in the first 12 months, and with much lower acuity, not so many patients in ITU, and much lower length of stay, and much lower mortality rate. So that the kind of period up to that red line was when we were almost challenged by COVID. And obviously we don't know what's going to happen next, and I would therefore urge everybody to make sure the booster jab's now available. We are seeing a bit of a rally of COVID cases across the NHS. That could be related to the need for there to be a booster. So really can't stress enough how important it is for people to come forward and receive their booster jab. So in terms of how we contributed to the battle with the pandemic, well, our staff were very, very much at the forefront of the fight against COVID. By March 22, in England, there'd been 119 million vaccines administered. 15 million of those were in the Northwest, but over 500,000 vaccines were administered at our very own St Helens Mass Vaccination Centre by our staff. And that's just it's a huge tribute to everybody who participated in that incredibly ambitious programme based at St Helens Rugby Ground. And many thanks to everybody who stepped forward to help us with that programme. In terms of research, we recruited 255 COVID positive patients into the recovery trial, and that trial led to the breakthrough with dexamethasone, which is a very affordable drug which has been in common use for other illnesses in the past, and did make a huge difference in reducing the severity of the illness even before the vaccine was available. Our staff also administered antiviral and immunosuppressive treatments to 336 severely ill patients in the community. Sorry, 332 severely vulnerable patients in the community and 336 in the hospital. So these were patients who were at extreme risk of both contracting COVID and then having a very bad outcome from COVID. So again, huge contribution from our team here at STHK to supporting our population through this very difficult time in this the most challenging of situations. So just like to move on now to our achievements and highlights of the year, because despite the many challenges, our staff always manage to come up with some amazing achievements for us to report on. So this is the photographs of us receiving the Freedom of the Borough of Knowsley, and this was awarded by our community of Knowsley to recognise the work of the hospital in addressing the pandemic and to the extent to which they protected the residents of Knowsley. And the Freedom of the Borough of Knowsley has only ever been awarded to 3 other organisations, so really special achievement for to be marked and to be recognised by our local population. And then shortly after that, we were given the Freedom of the Borough of St Helens. So similarly, huge accolade from our community, and something we should be very, very proud of, because these things are rarely awarded. But I think it's really important that we recognise just how much our community are grateful for everything that was delivered by our staff in terms of the way we supported the community. And we were also honoured with a Pride of St Helens Award for the way in which we tackled the pandemic. So one point I'd really like to make is that, you can see all these various members of staff on all these photographs. Just to say that every one of those members of staff is a former Employee of the Month. And when we were deciding, who to invite along to receive all these awards, we thought it was absolutely appropriate that we chose people who'd been Employee of the Month, because, obviously they'd done something really extra special, and most of all, embodied the values and behaviours that we prize so much in our organisation. And we wanted to really, reward them with the opportunity to represent the trust at these very special events. So again, there's partying at the HSJ Awards here, as we were recognised nationally for winning the Staffing Solution of the Year in collaboration with Patchworth Health for the HSJ Partnership Awards, and also highly commended in the Best Elective Recovery Initiative with the number of partners listed there, all seen having a lovely time and looking very glamorous. This is the anaesthetic departments who are being re-accredited by the Royal College of Anaesthetists. It's always hard to describe. This is a really hard thing to get to achieve, and hardly anyone has achieved it twice, and our anaesthetic departments have. So and look at the comments. Very impressive to see the commitment and approach of the whole department, demonstrated their ability and passion for providing the best possible care for their patients. So huge accolade for the Royal College, for our anaesthetic department from the Royal College of Anaesthetists. These photographs record the visit of Professor Sir Mike Richards, who was the cancer lead at the time, to the new diagnostic services that we've put into St Helens Hospital, which has enabled us to receive funding under the initiative around community diagnostic centres. And these are about being able to, it says on the tin, be able for the community to access diagnostics more quickly. And this includes all kinds of diagnostics like blood tests, x-rays, ultrasound, CT scans, and endoscopy, all in one place and much more quickly. So it's been a huge success. We've done a lot more diagnostic tests as a consequence of this being made available. And again, Mike Richards' comment there, very complimentary about the work we've done at on cancer services and at St Helens. We also had a visit, keep track of the Secretaries of State for Health, but this was the Secretary of State for Health at the time, Sajid Javid, came also to visit St Helens Hospital and looked at some of the services we provide. Things like the very, very innovative cancer helpline that we set up, where patients could just ring up, say, they thought they had cancer symptoms, and talk it through with a triage conversation, and then be referred on as appropriate. So he was again hugely impressed, and again there's a comment, best cancer services in the country, and quite incredible. So it was a very positive visit on the day, and again well done to everybody who was part of that. Another highlight of the year was our developing partnership with Southport and Ormskirk, and that began in September 2021 when we entered into our partnership, and the aim of that is to achieve greater resilience in services and provide high quality and sustainable services to all of the people we serve right across our patch. So what does that mean in practical terms? So the sorts of things that we've been doing as part of this partnership is you know, so it's just a year on, and in that year, we've managed to reopen the Southport and Ormskirk haematology service to new referrals. Previously, all of the patients would have needed to travel to Liverpool for treatment, and we've been able to maintain services locally to the population that Southport and Ormskirk serves. We've also been able to recruit staff to the paediatric dietetic service, and therefore been able to reopen that to new referrals. So that's a really big advantage for those young patients who need that service, and has significantly reduced waiting times to those who'd already been referred. So again, significant improvement achieved. Rheumatology services have also benefited from sharing clinical capacity about both trusts. That's helped to deliver new clinical pathways and again reduce waiting times at Southport and Ormskirk. And also we've managed to achieve just over £16 million in investments since last September to enhance service estates facilities on the Southport and Ormskirk sites. I'll give you some examples of what that was spent on. So we've managed to achieve funding to install a second CT scanner at Southport Hospital. Big problems there with only having one when it went down, as they do occasionally. So that's it's given it more resilience, but also being able to ensure we can get the stroke patients scanned in a timely way, but also all the diagnostic services. So obviously CT scanners in use for many numbers of different conditions. We were able also to access funding to increase the capacity at Ormskirk's endoscopy unit. You know, there's lots of issues around patients waiting for endoscopy investigations, and so it's, you know, that it was a really big prize to be able to shorten the time they will wait for the diagnosis. So that's enabled us to significantly increase activity and therefore reduce waiting times. And then brand new discharge lounge has been opened at Southport Hospital to help improve the discharge pathway. So that's what we've been doing there. So moving away from what we did last year to what we are doing this year. We find ourselves now in an entirely different system. Another reorganisation of the NHS has taken place, and this has created things called integrated care systems, and this went into legislation and therefore became active in July. So integrated care systems bring together NHS organisations, councils and wider partners, particularly the voluntary sector, within defined geographical areas to work much more collaboratively to support our patients. So the so there's 42 of these in England. There are 3 in the northwest that are pictured there. So Lancaster, South Cumbria, Greater Manchester and Cheshire and Merseyside. And of course from they are coterminous with the boroughs. There's 9 boroughs in on our patch of Cheshire and Merseyside, and the places are coterminous with those. And our patch contains 18 different trusts within that patch that we serve. And obviously the circle shows the particular catchment that St Helens and Knowsley Hospital serve, you know, covering largely St Helens, Knowsley and Halton, but also receiving significant referrals from both Liverpool and Warrington. Okay, so going forward, there are obviously some national performance requirements, and these are the things we've been asked to achieve by the national leadership. And so we were asked to have no 104-week waiters by the end of September 2022, which we delivered. We were asked to have no more than no 78-week waiters by the end of March 2023. So obviously that's work in progress. We currently have 386 people on that waiting list and are confident that by March they should all have been treated. However, we still remain somewhat anxious about winter pressures and COVID, but we'll be doing everything we possibly can to ensure that those 386 people receive their treatment before the end of March. The next requirement we've been given is to reduce outpatient follow-up attendances by 25% of where we were in 2019-20. And you can see there's a bit of a bold, not on plan statement there. And that's because really there's still a lot of patients from the pandemic that need the follow-up attendances. So, the view we've taken is that really to try and reduce follow-up attendances by that many when we've got a backlog of patients, we're not sure is the right thing to do for our patients. So we're working our way through it. We'll get as close to that target as we can, but if we don't achieve it, I think we've got a good explanation for why we won't achieve it. And that's because we're really putting the kind of safety of the patients, ensuring that nobody is lost to follow-up, because obviously there can be very negative consequences to that kind of thing. So we're proceeding with caution on that one. We've been asked to increase diagnostic activity to 120%, so we're at 93. Even quite recently, there's been another standing down of some of the infection control procedures. So again, optimistic that we might be able to get that figure a lot closer to where we're attempting to get to. Figure there for elective activity as well, 104%, and we're at 98.4% again. Optimistic that we'll be able to get much closer to that figure, but depends on what's going on with non-elective activity, which does crowd out elective activity, and also with if there is a resurgence of COVID. So doing okay so far, but that kind of it's hard to be entirely positive about some of these metrics. And therein lies the next line: 2% of patients should be waiting longer than 12 hours in ED, and we've got a very much worse situation that of having 16%, but that is just down to the sheer pressure on our emergency department. And the important thing we do is make sure that those patients are cared for properly while they're waiting, but we haven't got the beds to transfer the patients into, and that's what's causing the long waits in ED, because all the beds in effect hospitals are 100% full pretty much all the time, and therefore there isn't space to move the patients from ED. And the solution to that is we're going to try and access some more beds, probably off-site, in order to try and relieve the pressure on the emergency department and improve the patient's experience. So that's again one of our current top priorities that we're working on. And then the last performance there is improve performance against the cancer standards, so that we're achieving 75% of patients receiving diagnosis or exclusion of cancer within 28 days, and we're pretty much achieving that. So they're the kind of things that are being handed down for us from the national hierarchy, but obviously we have our own objectives and ambitions, and all based on delivering our 5-star care. Not departed from our aspiration to always deliver, best practice care with great communication, with reliable systems, with appropriate pathways, and most of all with the utmost attention to safety. It remains our driving vision, and will always be the thing that influences our corporate objectives. And these are they. So these are the trust objectives for 22-23, always launched at our start of the year conference, which takes place in April, at the start of the financial year. And as you can see, we base that around the elements of our five-star vision: care, safety, pathways, communication system, so that we always have objectives that take us closer to delivering where we want to be in terms of our 5-star aspiration. And then obviously some other objectives around operational performance and finance and strategy, and very much especially our care of our workforce and our maintaining our positive culture. So these objectives become the personal objectives of the executive directors, and as you know, everybody in the organisation works for one of the executive directors. They're cascaded down right through the organisation so that everybody knows what we're trying to achieve and shares in our efforts to deliver on this. It's certainly not just something we put on the walls, it's something we absolutely do all we can to deliver against, and make sure everyone can work together to know what we're trying to achieve by being very clear about what we're trying to achieve. If I was to summarise that into, so what does all that say then? It says that, you know, our absolute priority is the well-being of our staff and the safe and excellent care of our patients. And we know those two things go hand in hand. I mentioned earlier that we're absolutely desperately trying to make our organisation as safe as it can be, and we're really focused on reducing incidence of falls and pressure ulcers, working closely with partners to improve urgent care pathways, attempting to return elective care to at least 1920 levels. We are focused on implementing the maternity recommendations set out in the Ockenden report. We're also trying to improve the effectiveness of the discharge process to help the flow through the hospitals, given my comments about we're actually 100% full pretty much all of the time, or even more than 100% full. And we will continue to work in partnership with Southport and Ormskirk to explore further opportunities to strengthen our partnership and improve our services. And we've also got a number, haven't not really done anything much to our buildings since we opened them. We've got quite a lot of capital schemes that are taking place to expand our facilities. So all of the things we've achieved, all the things I've described are down to the work and contribution of our absolutely outstanding staff, and all of the things we will achieve in the forthcoming year will be all down to the work and achievements of our outstanding staff. And so, as ever, both myself and the whole of the Trust Board can't thank and praise them enough for the absolutely wonderful work they do every day to care for our patients. So always the biggest message from the review of the year and the discussion around the aspirations for the forthcoming year is to acknowledge just what an amazing job our staff do every day for our patients. So that's me done, and thank you.
Thank you, Anne. That was a very detailed and very helpful review. And it concludes this year's annual general meeting. We have received no written questions ahead of the meeting today, but if following the presentations you've seen, you would like to ask a question, then please feel free to email me at chairman@sthk.nhs.uk. Now, all of our statutory documents, the annual report, annual accounts and a quality account will be available on the Trust website immediately after this meeting. If you require a hard copy, or you would like to request these documents in a different language or an easier to read version, please don't hesitate to let me know. To finish, and to echo Anne, I would like to add my own personal thanks to all of our wonderful staff. For all they have done and continue to do for our patients every single day. And I can't end the review of the year without also mentioning the incredible support that our Trust have received from our local community. Thank you to you all for your kindness, encouragement and support for our staff. Thank you.